Hey internet. If you're here, you probably saw my recent short video talking about how I was in the hospital last month and got diagnosed with FND or Functional Neurological Disorder. This is a longer companion video to that. I kind of just want to talk about what happened, how I ended up in the hospital, what kind of happened at the hospital, how I ended up getting diagnosed with FND and symptoms, what my recovery's been like. I just want to talk a little bit about that. And if you didn't come from that short form video, hi, I'm Cassie. Nice to meet you. I am disabled now, I guess. Also, apologies in advance. I am doing pretty bad today. Everything's a little wobbly. I'm trying to not wobble around too much, trying to not show too many of my tics and other stuff, trying to not let the brain fog win today. My legs do sort of work today, so that's good. But that was kind of why I was in the hospital in the first place and how I got diagnosed. So anyway, let's go ahead and get into it. So what happened was sometime last month. It was a Monday, like any other Monday, and I woke up and my legs didn't work. They were really numb, really cold, could barely feel them, couldn't move them. I was concerned. My partner was a little bit concerned. Well, we scheduled an appointment with the primary care doctor, which was the next day. Oh, and the other thing was that we also noticed some bruising along my back near my spine. I'll put a picture of it up on the side. And later we figured out that it was probably from just physical therapy. I was pressing my back against the table a little too hard or something like that. But my legs just stopped working, and that was really concerning. And I was also just in a lot of pain and other stuff going on. The next day, my partner and I went to the primary care office. We talked to my primary care provider, and she talked through. She's like, "Oh, it might be something neurological. Probably wasn't an SCI though," was what she thought. And during that appointment, I actually started to feel really bad, and I started to the pain started kind of getting worse, and I started actually kind of feeling like I was going to faint. And at that point, the primary care provider just looked at my partner and just told her, "Hey, you just take her to the emergency room. They'll figure it out there." It was like, yeah, she's not doing that good, And no, I was not doing that good. I thought I was I had trouble staying conscious because of how much pain and fatigued I felt. And it was extremely uncharacteristic even for me, just because I was diagnosed with fibromyalgia previously during this year for other reasons, but it was nothing like that. And yeah, so what happened was after that, my partner took me to the emergency room. At this point, my legs were still not working, very cold, very numb. It's very, very confusing for me because I was basically floating in and out of consciousness at that point. But we made it to the ER. They checked me in. They did MRIs, x-rays, CT scans. They scanned my head, my spine and stuff. All of that turned out negative, which is good. They did do some blood testing, and all of that seemed to be pretty negative as well. But the ER doctor came back in and just said, your legs are physically cold to the touch, right? And they don't work. That's the main one, right? So they were just concerned, and they said that they were going to keep me at least overnight. So what happened was I ended up staying at the hospital. They moved me to a temporary bed, and then I was moved to the neurology intensive care unit. They did conclude that it was probably some kind of neurological thing. I guess I got to see a neurologist. But yeah, so I stayed in the neurology intensive care for a few days. During that time, they did a bunch more tests on me. They did more MRIs, more scans. They did a second lumbar puncture on me while I was in the neurology intensive care unit. That was the second one. The first one actually happened in the ER, but they didn't get any fluid, so that one didn't really count. Both of them hurt, by the way, but I was fine. And yeah, so they checked for things like MS, GBS, other things that could be causing these symptoms, but all of it came back negative. Eventually, at some point, I did get a psych eval, so they did kind of see what was in my past. They did note that I had a PTSD diagnosis in 2017, and just various other traumatic events that kind of happened over the course of my life. Okay, we did make a note of that. I legit thought that I was kind of past those, right? My mental health is fine. I've been seeing a therapist once every 2 weeks for years. Most of the bad things that I'd been through, I'd kind of put behind me at this point. But it was just kind of surprising to me because what they said was basically it seemed like I was having some kind of conversion disorder related stuff, and conversion disorder is now under the kind of FND umbrella. But they said that it seemed like I was having kind of motor related difficulties with everything, just because I had so much trauma, and that kind of affected my nervous system and brain, which means not being able to move my legs. And while I was in the hospital, I also started developing tremors and motor tics and other stuff. Though, I mean, I also had like kind of motor and vocal tics before that I'm pretty sure are not related to FND, but I'm doing my best to suppress them right now. Can you tell? But anyway, so they basically just, concluded that like, because all of the other tests were negative and that my like psychological history had so much stuff in it. Like I might talk about that in another video, like my psychological history, but it's not, what you need to know is that there's stuff happened and I legitimately thought I had kind of gotten over everything and like I'm not dealing with it, but just I guess there was still damage there because it just reared its ugly head and, it just like took my walking away from me one day. Also, I guess at this point it's probably worth mentioning, like I have been a part-time wheelchair user since this year, but that was because of other conditions. So I've been dealing with like hypermobility and trouble standing up. So my primary care and outpatient physical therapist thought I had POTS and EDS. So the fibromyalgia is the only one that's diagnosed, but the POTS and EDS, I have to wait for another 6 or 7 months from when I recorded this video, which kind of sucks, but again, just complicating factors. Okay, where was I? I was in the neurology intensive care unit basically until they diagnosed me and they kind of figured stuff out and I was stable. I mean, stable, right? Like as in like they figured out what it was and then I was transferred over to the main hospital to wait. And while I was there, I was still dealing with other symptoms. I was dealing with, the tremors and stuff. Like what happened was I would try to sit on the edge of the bed and the ball of my feet would be on the ground and my legs would just tremor like crazy. But, the tremors sometimes came to my arms as well. Like my whole body was relatively weak. I had a lot of like motor tics and like twitching and other stuff. Just a lot of twitching. I was also just kind of fainting and having seizures basically. Like they're the FND seizures, so they're non-epileptic, but they can look like when you're like, they can look like you're just like staring off into space and not able to do anything. You can't like physically move, which is pretty terrifying to be honest. They basically didn't let me out of the bed for most of it. Like I was not allowed to go to the bathroom without calling for a nurse to come and make sure I don't fall, which kind of sucked. To be honest. But yeah, I basically just stayed in the main hospital for a few days because they were trying to get me cleared to go to the inpatient rehab program because they were thinking, well, a lot of the doctors there were thinking that, I'd be better if I was able to just do like really intensive rehab for like a week, 3 hours a day for like a week or two, try and get the function back. But unfortunately, insurance did end up denying to pay for that. The insurance did pay for the rest of the hospital visit though, so I'm not too concerned. But what happened was they sent me home at the end of that. Well, what actually happened was that I made them send me home because I was sick and tired of sitting in the hospital and it was the straw that broke the camel's back. I really wanted to go home and it's like, okay, well, insurance isn't going to pay for this. What are you going to keep me here for? But the day that they told me that insurance denied it, the doctors had already left for the day. So I was like, can I leave? And they were like, you can, but you have to sign the consent form to like end treatment. And then, you won't get discharged normally. And I'm like, okay, I can't do that. And that would, cause a lot of issues. Like it might affect insurance paying for the hospital visit. It might affect getting prescriptions after I leave because they actually prescribed me a couple medications while I was there to deal with like my neuropathy in like my hands and legs as well. And to deal with the, to deal with my PTSD basically. Because they asked me, like, do you still get like PTSD flashbacks? And I was like, yeah, like maybe once or twice a week. And they're like, okay, we'll give you something for that. And I'm happy to say that did help a lot. And they also gave me the medication to deal with my neuropathy also helps reduce my anxiety, which is nice. I learned that I was actually more anxious than average and I was not as mentally okay as I thought I was, which is a little bit sad, but that's okay. And yeah, I basically had to wait for the next day. And this is funny because I actually got out on Halloween. And that made it really funny because when I left the hospital to go to the pharmacy, the pharmacist, like, it was a joke, right? Like, and also, like, I know she didn't mean any harm. She was like asking, like, oh, are you like actually in the wheelchair or is that a Halloween costume? Which is just so funny, but that's just so funny to me. And I was like, oh, I literally just got out of the hospital today. And she was like, oh, yeah, well, I guess it's kind of hard to tell on Halloween. I'm like, yeah, I guess that's true. Because what happened was I had rolled up to the thing and like, my arms were like covered in bruises. You can probably actually still see on this arm, you can actually see on this arm, there's still a bunch of adhesive from the hospital things. And there's a bunch on my chest as well. I don't know if you probably can't see them from here, but I was covered in like bruises all over my arms and I was in the wheelchair and like, I wouldn't blame anyone for thinking I was just some character, but I think it's relatively poor taste to do that. But anyway, I got my meds. I went home, right? So went home. Well, the hospital set up home health care for me, which is like kind of a health service. So like nurses and like physical therapists and occupational therapists will like come and visit you throughout the week. But yeah, so I've been home. Been home for like 3 weeks. Been kind of doing stuff. My birthday passed. The election happened. I had honestly missed it. I voted early, but I still missed everything that happened. I honestly missed a lot of stuff while I was at the hospital. I missed like, some D&D sessions, missed some, I was able to visit my parents at least after I got back from the hospital. So that was nice. Yeah, I'm still just hanging out. Tried to go back to work. It sort of worked, sort of didn't. It's not too bad because, I can work remotely, but it was just definitely a struggle. And I still need more bed rest is what the nurses say. So. Oh, I should probably mention, like, if my symptoms have gotten any better. My legs sort of work. I mean, like I said, my legs sort of work. A lot of the tremors are gone. I don't deal with them as much anymore. That's not true. The tremors still like affect my legs. My upper body is doing a little better. I'm still struggling to like be able to draw like straight lines some days with my arms, but for the most part, I think it's a little better. I still really kind of struggle to walk, to be honest. I still really struggle to walk a lot. I'm still using a wheelchair. It's like almost full time. I learned to use crutches to kind of walk around. Using a cane kind of isn't really super safe for me right now. I also use a walker. It's kind of hoping not to have to deal with that. But yeah, lots of mobility aids right now as I've been slowly waiting for, I guess, this flare up to pass. Still seeing physical therapy, occupational therapist, and like those things, try and get my legs working a little better. Still, unfortunately, my other chronic illnesses have been affecting my recovery. So it's like, I have injured both of my ankles and knees a lot over the course of my life because of the hypermobility issues that I have, which meant that I was able to walk for a little while with crutches. I actually took 3 laps around one of the courtyards in my apartment complex. And then that rest of the week was awful because I re-injured all 4 of those joints, and it was awful. Like I was in bed the next couple of days. That was pretty bad. So, it's been slow, been a lot of using the wheelchair, a lot of everything. I'm just, really tired. Luckily, my partner lives with me, so she can just drive me places if I need to. I can't really, my dreams of riding my motorcycle again have been pushed back even further than they were before, which sucks a lot. I'm pretty sure I'll never be allowed to fly an airplane. So that very small dream I had from since I was a kid is probably gone now. I can still draw, luckily. I was kind of scared because I was in the hospital and I was like, couldn't really even draw a straight line for even a little while. But now like that's kind of come back for the most part. So that's good. I just wish my legs would work, It's funny because wasn't like I remember reading my hospital notes and they listed like FND of course, but they also said functional paraplegia, and I guess I've been feeling weird about using the term paraplegia because I always feel like that just belongs to the SCI community. But here I am like oh, my legs just don't work sometimes. I don't know. It's a complicated. I'm sure no one's actually gonna get mad at me for using that term. I mean, effectively that term just means like your legs don't work, right? Or like your lower body function is impaired, and that is what's happening to me. Yeah, I don't know. It's been 3 weeks since I left the hospital. Just trying to live, living a quiet, peaceful life. Sorry, I haven't posted on YouTube in a really long time. And by really long time, I do mean like just a month and a half. It's just there was just so much stuff going on that I obviously didn't want to deal with that. Now I'm back. Guess I'm making disability videos now. I mean, to be fair, I was making them before, but I guess I'm making more disability videos now because I caught a new one. I caught a new disability for my Pokédex. Yeah, so that's what happened to me over the last month. Glad to be back, I guess. Sorry to my friends and family who might be finding out from watching this video because I'm sorry I didn't tell everyone. If you're new here, like and subscribe, I guess. I don't know. I'll be making disability videos and art videos and other stuff. Yeah, that's it. See y'all next time. Bye. Final mic check, The friends right here. Looking at the camera, hi. Looking at the camera. Oh boy. I hope I can get there. Can I show my legs? I can show my legs a little bit. Grab my legs. Okay. This is so hard. I didn't do it. Okay. Do not tick on camera. Voice talking. Camera. Camera action. This is so hard. Tiny shark for the camera. We're a tiny shark for the camera.